Master the essential skills for compassionate and effective dressing, toileting, and feeding assistance to provide dignified care. This course provides essential instruction for CNAs and healthcare support workers in assisting patients with dressing, toileting, and feeding. These critical activities of daily living, ADLs, ensure the patient's comfort, dignity, and hygiene, and are foundational skills for any healthcare professional. Assisting patients with activities of daily living, ADLs, including dressing, toileting, and feeding, is a core responsibility of nursing assistants and healthcare workers. These activities help patients maintain their independence, dignity, and health, and CNAs must provide care with skill, sensitivity, and respect. This course covers proper techniques, infection control, safety considerations, and documentation practices to ensure effective and compassionate patient care. Introduction to Activities of Daily Living, ADLs, and their importance. Activities of daily living, ADLs, refer to basic tasks that are essential for maintaining personal hygiene and overall well-being. In the healthcare setting, ADLs are often provided by nursing assistants or caregivers when patients are unable to perform them independently. Core ADLs include dressing, helping the patient put on or remove clothing; toileting, assisting with using the toilet and maintaining hygiene; feeding, helping the patient eat or drink, particularly when they cannot do so on their own; bathing and grooming, maintaining hygiene through bathing, shaving, and personal grooming tasks; mobility assistance, helping patients move or reposition themselves safely. ADLs are essential for maintaining a patient's physical health, emotional well-being, and sense of independence. For CNAs, assisting with ADLs requires technical skill, patience, and sensitivity, ensuring that patients are treated with dignity and respect throughout. Dressing assistance, techniques, and patient comfort. Dressing assistance is often a personal and intimate activity that requires respect for the patient's dignity. Some patients may need help due to physical limitations, cognitive impairments, or post-surgical recovery. Steps for assisting with dressing. Ensure privacy. Always provide privacy by drawing curtains or closing doors. Position the patient. Help the patient into a comfortable sitting or reclining position before beginning. Assist with clothing. Choose clothing appropriate for the patient's condition, comfort, and weather. Start with undergarments, helping the patient to insert limbs through openings. Assist with buttons, zippers, or other fasteners. Adjust for comfort. After dressing, ensure there are no wrinkles or tight spots in the clothing that might cause discomfort or pressure. Assist with footwear. Help the patient put on shoes or slippers, ensuring they are stable and comfortable. Key considerations. Always respect the patient's preferences for clothing and style. When possible, encourage the patient to participate in the dressing process to maintain their independence. Be mindful of patients with physical limitations, such as joint pain or reduced mobility, which may make dressing more difficult. Toileting assistance, maintaining dignity and hygiene. Toileting assistance is one of the most sensitive tasks in patient care. It's crucial to preserve patient dignity while providing safe and hygienic assistance, especially for those with limited mobility, cognitive impairments, or post-operative recovery. Steps for assisting with toileting. Ensure privacy. Close the door or draw curtains to provide privacy. Assist to the toilet. Depending on the patient's mobility, assist them to sit on the toilet, commode, or bedpan. Provide necessary assistance. For patients with limited mobility, help them balance or position themselves. Ensure that the patient is comfortable and secure. Provide hygiene support. After toileting, assist the patient with cleaning from front to back, especially for females, using toilet paper or wet wipes. Help with redressing. Assist the patient with lowering or raising clothing and ensuring that they are fully dressed. Ensure comfort. Make sure the patient is comfortable before leaving them and that the bathroom area is safe to navigate. Key considerations. Always wear gloves when assisting with toileting tasks. Check the skin for signs of irritation or infection, especially in areas that are in contact with moisture. Respect the patient's privacy and comfort by giving them control over the situation whenever possible. Feeding assistance. Safe practices and promoting independence. Feeding is another crucial aspect of patient care. Some patients may require assistance with feeding due to illness, injury, or cognitive impairments. It's important to promote independence while ensuring safety during mealtime. Steps for assisting with feeding. Ensure proper positioning. Position the patient upright, either in a chair, wheelchair, or bed, at a 45-degree to 90-degree angle to prevent choking. Prepare the meal. Ensure food is at a comfortable temperature and that any dietary restrictions or preferences are followed. Encourage patient participation. Encourage the patient to feed themselves as much as possible to maintain their independence. Assist with utensils. If necessary, help guide the patient's hand or provide adaptive utensils for easier grip and use. Monitor for safety. Watch for signs of choking, especially if the patient has difficulty swallowing, dysphagia. Offer small bites and sips, and encourage the patient to chew thoroughly. Provide fluids. Offer water or other liquids as needed to stay hydrated. Clean up. After feeding, clean the patient's face and hands. Dispose of any leftover food properly. Key considerations. Always ask the patient about their food preferences and respect cultural or religious dietary restrictions. If the patient has swallowing difficulties, ensure you follow proper protocols. Example, thickened liquids to prevent aspiration. Be aware of any changes in appetite or eating habits, as these may indicate underlying health issues. Infection control and safety during ADL assistance. Providing ADL care requires strict adherence to infection control measures to prevent the spread of disease, particularly when assisting with toileting, feeding, and dressing. Key infection control practices. 1. Hand hygiene. Wash your hands before and after assisting with ADLs to prevent cross-contamination. 2. Gloves. Wear gloves when assisting with feeding, toileting, or when there is contact with bodily fluids. 3. Disinfect equipment. Clean and disinfect any tools or surfaces after assisting with ADLs. Example, bedpans, wheelchair trays. 4. Use PPE as needed. Wear appropriate PPE. Example, gown, mask, if the situation requires additional protection. Example, handling blood or bodily fluids. 5. Safe disposal. Dispose of any soiled materials, wipes, or pads in designated waste containers to avoid contamination. Key considerations. Be mindful of infection control protocols when assisting with feeding, particularly with high-risk patients or during meal preparation. Always ensure that the environment is clean and free of hazards that could lead to patient injury or infection. Cultural sensitivity, patient dignity, and personal preferences. Respecting patient dignity and cultural sensitivity is a core aspect of ADL assistance. Patients may have personal, cultural, or religious preferences regarding their care, and CNAs must accommodate these preferences while ensuring safe and respectful assistance. Key practices for maintaining dignity. 1. Ask for preferences. Always ask the patient how they prefer to be assisted, especially when it comes to dressing, toileting, or eating. 2. Be non-judgmental. Approach each task with sensitivity, particularly when assisting with personal care. 3. Maintain privacy. Close doors, use screens, and avoid exposing the patient unnecessarily. 4. Empathy and communication. Use compassionate communication to explain the process and reassure the patient during each task. Key considerations. Always be respectful of the patient's autonomy and preferences. Ensure comfort by using appropriate language and gestures that reinforce trust and respect. CNA responsibilities in ADL care and documentation. CNAs are responsible for assisting with ADLs and documenting their actions. Proper documentation ensures continuity of care, supports patient safety, and ensures compliance with healthcare regulations. Documentation guidelines. Record assistance provided. Log the type of ADL assistance given, including any difficulties encountered. Monitor changes. Document any changes in the patient's condition, such as skin irritation, changes in appetite, or refusal of assistance. Report issues promptly. If a patient exhibits signs of distress, discomfort, or refuses care, report it to the nurse immediately. Key considerations. Ensure all documentation is accurate, clear, and timely. Always report any concerns regarding patient health or safety to supervisory staff.